So under the care of Dr. Brezden, one of the remarkable things that uh, my family and I feel she was able to do was help us understand and sort of disentangle, if you will, the diagnosis that I had from the prognosis. So the diagnosis, what I mean by that is I had stage 4 colorectal cancer that had metastasized to my liver and my lungs. The prognosis was, very, very low survival probability 5 years out, like significantly below 50%. Um, and as we had to navigate a lot of the medical community through different specialists, that prognosis would often have to be part of the discussion. It just is. Um, and again, what we found remarkable about Dr. Brezden and her team and her tone was anchoring back to the diagnosis and you know, what we could do and the actions that we could take and the actions that she was going to take for us to address where the cancer was. And really that allowed us to focus on actions that were within our control versus things that weren't. And this became for me personally, a really important concept. Um, and uh, and Dr. Brezden was sort of like quite remarkable in her steadfastness and ability to separate the two. And looking back at it and looking back at her treatment, that was quite powerful for us and for me personally, and certainly for the family. It was an aggressive treatment plan that she laid out, very aggressive. And I think part of the philosophy that she brought to my treatment, whether she explicitly stated it or not, was, but I certainly felt it. My family certainly felt it. Like she was trying to bring like the future to us, or bring us to the future. It was, and really try to figure out you know, what boundaries, essentially what boundaries my body would physically and mentally allow us to do. Again, focusing not on what the prognosis, what the statistical data says, and focusing on me as an individual, my family as an individual family, and really, really trying to push forward as far into the unknown, if we had to go, as we could. And for me, one of the things that March represents is it's the time of year where I was actually diagnosed with stage 4 colorectal cancer. Looking back at it, I mean, that was 7 years ago. It's hard to believe the journey that I've had, and I think that's partly why I feel it's important to sort of step out of the shadows a little bit now and bring awareness to colorectal cancer. Increasingly, cancer is hitting, is being discovered at younger and younger ages. That's many statistics that are showing that. And colorectal cancer is one of the ones that is actually as well that is growing quite quickly. So there's a level of bringing a greater awareness, and also bringing a level of normalization to it. We don't, I think there's at times a discomfort for wanting to talk about certain types of cancer. This is common, more common than we want it to be, and that's why the doctors are working so hard to figure out how to prevent, and then importantly, how to treat. One message I really want to send out there to people is, if you look at the symptoms, you can check it out. If something doesn't seem right and some of those boxes are getting checked, advocate for yourself, check in with your GP. We know that through things like colonoscopies and scopes and these types of things, that caught early, it's really treatable.